Hello, my friend. I'm Dr. William Hart, a geriatric doctor, a storyteller, and above all, a companion to many who are navigating the journey of health and aging at 60, 70, and beyond. Today, I want to invite you into a conversation, not a conversation about medications, but about the quiet signals your body might be sending. The tiny nudges so small we often overlook them that if ignored can one day become loud alarms. Have you ever felt unusually thirsty throughout the day, even when it's not hot outside, or found yourself using the bathroom more frequently, especially at night? Or maybe you've been feeling inexplicably tired even when you haven't done much. Those things aren't always just age. Sometimes they're the body's way of whispering something's not right. And more often than not, it could be the earliest signs of one of the most common and quietest conditions after age 50 type 2 diabetes. I remember a former patient of mine, Eleanor, 67. She came to me one day with a puzzled look and said, "Doctor, my mouth is always dry, my vision's blurry, and my feet sometimes feel tingly. But I suppose that's just aging, right?" That question made me pause for a moment, because behind that, it's probably just age. Was a diagnosis she wasn't ready to hear: early stage type 2 diabetes. Here's what I want you to take from that. Diabetes doesn't begin with lab results. It begins with feelings. A little fatigue, a little hunger, a bit of blurry vision. And we grow used to it. Then one day a doctor says, "Your blood sugar is a little high, we should monitor that." And the journey begins. But if I could turn back time, I would have looked Eleanor in the eyes and said earlier, "What you're feeling isn't just age, it's a signal. Your body is calling out." You see, I'm not here to scare you. I'm here to offer you something much more powerful: awareness. Because I believe knowledge is the first medicine, and small daily actions can change the course of the next 10 years. So today I want to walk you through 7 early signs of diabetes that everyone over 50 should pay close attention to. Signs that may seem normal, but if caught early might just turn everything around. Before we begin, I invite you to reflect. Are you experiencing 2 or more of these symptoms? And if so, will you choose to listen to what your body is trying to say? Remember this: we can't turn back the clock, but we can take charge of the present. And sometimes a simple nod, "I'm ready to care for myself." Starting today is where the miracle begins. Shall we? Let's start with, have you noticed that you're drinking more water than usual but still feel parched? Not after exercise, not due to the heat, just an unquenchable thirst, like your mouth is dry as a desert. If that sounds familiar, especially after age 50, stay with me. I remember an older gentleman named Henry, 62. Whenever I visited him, there was always a giant glass of ice water on the table. "Doc, I'm just always thirsty lately. I can't go without water. It's unbearable." At first, I didn't think too much of it. We all need water, right? But then I started to notice he was drinking more, yet still tired, his mouth dry, and constantly going to the bathroom. That's when I suggested a simple blood sugar test. The result: early stage type 2 diabetes. When blood sugar rises, the body tries to get rid of excess glucose through urine. To do this, it pulls water from your cells, leaving you dehydrated and constantly thirsty. That's why persistent thirst is often one of the first and most overlooked signs of diabetes. People tend to brush it off. "Maybe I ate too much salt. Maybe it's just the weather." And just like that, they miss one of the body's earliest warning signs. So if you've been drinking more water than usual, especially waking up thirsty at night, ask yourself, is this a new thing for me? Am I also feeling dry mouth, fatigue, or frequent urination? If the answer is yes, please don't wait. See your doctor and request a simple blood glucose test. Because here's the truth, my friend: the body never stays silent. It always whispers. The question is, are we listening? Frequent thirst may be one of the gentlest warning signs. Don't overlook it. Good morning, my friend. Did you sleep well? Or did you wake up 2 or 3 times last night? Not because of dreams, but because your bladder woke you up again. If that sounds familiar, today's message is especially for you. One of my patients, Walter, age 67, came to me not for pain or fever, but for something much more subtle. "Doc," he said, "I'm just exhausted. I can't get a full night's sleep. Every night I wake up 3 or 4 times always to go to the bathroom. And the strange thing is, I don't even drink that much water." You see, Walter isn't the only one who's told me this, and he certainly won't be the last. When your blood sugar is too high, your kidneys have to work overtime to flush it out. This pulls extra water from your blood, which means You urinate more often, not just during the day, but at night when your body should be in deep restorative sleep. And you know what happens next? You lose sleep, you wake up tired, you become forgetful, irritable, and everything starts to feel heavier. All because of a quiet loop we've come to accept as just getting older. I asked Walter, "When did you first notice this?" He replied, "Oh, it's been a while. I just figured it's part of aging." But my dear friend, not everything that happens after 60 should be blamed on just age. Some changes are not normal. Some are alarms from within. Type 2 diabetes doesn't show up overnight. It builds silently year by year, starting with signs like frequent thirst, frequent urination, especially at night. And do you know what the most concerning part is? Many people ignore all of these signs. Today, I want you to gently ask yourself, have I been waking up more than once a night to go to the bathroom? Is this happening regularly now? Do I feel tired during the day, even if I slept long enough? If your answer is yes to two or more of those questions, then this isn't just about sleep anymore. This might be a quiet signal from your body that your blood sugar is changing silently. You deserve restful sleep. You deserve to wake up refreshed. You deserve a later life that doesn't depend on caffeine or sleeping pills just to function. And it all starts with one thing: listening to your body. If your body is whispering, "I need help," then please don't ignore it. Frequent urination, especially at night, is not just a normal part of aging. It could be the very first whisper of diabetes. And as I often remind my patients, it's never too late to prevent, but early detection is always better than late treatment. Have you ever noticed that suddenly the world around you looks hazy? The words in your book seem harder to read, or while driving, you can't quite make out the street sign ahead. Then a few hours later, everything looks fine again. If you're nodding right now, I need you to stay with me a little longer, because these subtle changes may actually be early signs of diabetes. Let me tell you about a former patient of mine, Linda, a retired school teacher in her early 60s. Linda loved books. She had her own little reading corner by the window with perfect lighting. But one day she came to see me and said, "Doctor, I've had to change my glasses 3 times in the last 6 months. Sometimes I see clearly in the morning, then by noon it's all blurry. By evening, it's like fog." She thought she just needed a stronger prescription. But my gut told me it wasn't just her eyes. You see, high blood sugar can change the shape of your eye's lens, which affects the way light focuses, leading to temporary blurry vision. The tricky part is this: you'll think you need new glasses. But the real issue isn't in your eyes, it's in your blood. Linda's stories is a perfect example. We did a simple blood test and found that her fasting glucose level was in the pre-diabetic range. She had no other clear symptoms, just that occasional blurred vision. With some diet changes, light exercise, and stress management, her vision stabilized. More importantly, she stopped diabetes from progressing. Because in your body, sugar doesn't just affect your kidneys, brain, or heart. It quietly damages your eyes, the windows through which you see memories, love, and independence. If left unchecked, high blood sugar can lead to more frequent blurry vision, diabetic retinopathy, permanent damage to the retina, increased eye pressure, a risk factor for blindness. And I don't want you or anyone to lose the light of life just because they ignored a symptom as small as blurry vision for a few hours. So today I want you to pause and ask yourself, have I noticed more fluctuations in my vision lately? Do I need to change my glasses more often than usual? Do my eyes get blurry when I'm hungry or after eating a lot of carbs? If your answer is yes, please don't wait. A simple blood sugar test can explain a lot, and it might just give you a chance to prevent what could have become permanent damage. As I always say to my patient, don't wait until you can't see your grandchildren's faces clearly to get your eyes checked. Blurry vision may be a gift, a gentle warning from the body, and like any gift, it's best opened on time. So you see, a small sign can hold a very big message. Have you ever woken up after a full 8 hours of sleep, but still felt like you had no energy to face the day? You sit at the breakfast table, but food doesn't even seem appealing. The entire morning passes, and you just want to be still. No talking, no doing, just stillness. And maybe you tell yourselves, I guess I'm just getting old. But no, aging alone is not always the reason you feel tired. In many cases I've seen, especially after 60, chronic fatigue without a clear cause is often one of the first signs of type 2 diabetes. Let me tell you about Mr. George, 67 years old, a retired mechanical engineer. He came to see me after feeling drained for nearly 3 months. No pain, no fever, just a sense of, I'm not myself anymore. He used to walk 2 miles every morning, tend his garden, and loved to cook. But lately, he said, I was just peeling a few potatoes, and I had to sit down halfway through. And here's the thing, he didn't feel sick. When blood sugar is high, the body struggles to use glucose, your main energy source, efficiently. The result? Your cells are starving even if you're eating well. You may feel muscle fatigue, weakness, difficulty concentrating, lack of appetite or sudden sugar cravings, mood swings, irritability. Your body is like a plant. If it doesn't get the right water, its leaves wilt, its branches droop, but with the right care, it comes back to life. After a simple fasting glucose test, we found George's level at 145 ml above the normal range. With a better diet, gentle exercise, and proper rest, he was back in the garden within 6 weeks, smiling hands in the soil. My friend, if you've been feeling tired more often than not, don't just assume it's your age. Instead, ask yourselves, does this kind of tiredness feel normal for me? Am I getting tired even when I haven't done much? Could this be my body's way of asking for help? Diabetes doesn't strike like a storm. It moves quietly like a soft breeze, but one that can slowly shift the course of your entire life if you don't notice. Fatigue that seems so minor might just be that breeze. Be proactive. See your doctor if you feel like you're not quite yourself anymore. When I turned 60, I went through a phase where I lost a few pounds. I remember smiling in the mirror and thinking, maybe I'm getting healthier. But then one of my patients, Helen, reminded me that sometimes weight loss isn't a good sign. Helen is 72 years old. She lives alone, eats simple meals, and still works part-time at a local library. Over just 2 months, she lost nearly 13 pounds, 6 kilos. But the strange part, she wasn't dieting, didn't change her routine, and wasn't exercising more than usual. I figured maybe I was eating less. Or maybe my digestion just isn't the same at my age, she said during our visit. But when we ran a blood test, her glucose levels were significantly elevated. Her prediabetes had silently progressed to full type 2 diabetes. You see, when your body doesn't produce enough insulin or can't use it properly, glucose, your main energy source, can't enter your cells. When your cells are starving, your body starts breaking down fat and muscle to make energy. The result? You start losing weight even if you're eating normally. In older adults, unintended weight loss can signal many things: thyroid issues, cancer, or yes, diabetes. What I want you to remember is this: if you're losing weight without trying, especially after 50, get checked. Helen changed her diet, got early treatment, and is now gaining weight back steadily, still happy and active at the library she loves. Weight loss can sometimes mean progress, but unexplained weight loss at 50, 60, or 70 may be your body whispering a deeper message. Ask yourself, have I or someone I love lost weight without knowing why? If yes, please talk about it, and maybe your story will help someone else catch a disease before it advances. Have you ever had a small scratch on your leg that just wouldn't heal? Or a little cut while cooking that stayed red and sore for a week or more? That may be an early warning sign your body is quietly giving you. I remember Mr. Jerry, 68 years old, a cheerful man who loved gardening. One day while trimming bushes, he got pricked by a thorn. "It's nothing, Doc," he said casually during a checkup 2 weeks later. But I saw it still red, slightly swollen, and beginning to show signs of infection. We did a blood test. His fasting blood sugar was far above normal. When blood sugar is high, it makes your blood thicker and circulation slows down. This means oxygen and nutrients don't reach wounds effectively. White blood cells, your body's defense system, can't work efficiently. The result: wounds take longer to heal and are more prone to infection. Slow healing wounds, especially on the feet, are one of the most dangerous signs of undiagnosed diabetes. If ignored, they can lead to diabetic foot ulcers, and sadly, over 100,000 people each year in the U.S. undergo amputations due to this condition. I understand no one likes going to the doctor for a small cut, but if a wound doesn't heal in 7 to 10 days, or stays red, sore, or starts leaking, please get it checked. You might be discovering diabetes before it becomes serious. Remember these 3 signs of a slow healing wound? It takes more than a week to close. There's redness, fluid, or persistent soreness. There's tingling, numbness, or a burning feeling around the area. Thanks to that small scratch, Mr. Jerry was diagnosed early and now keeps his blood sugar under control. And yes, he's still gardening every week now with gloves and sturdy shoes. I truly believe your body always speaks to you. The question is whether you're listening. Slow healing may be a whisper from a bigger disease. Don't overlook it. I still remember Linda, 63 years old, a retired elementary school teacher. She came in with what seemed like a minor concern. My gums keep getting inflamed, doctor. I brush carefully, but they still bleed a few times a month. At first, I thought maybe her oral hygiene needed adjusting, or it was just a sign of aging. But when I asked more questions, she added, sometimes I also get itchy skin around my fingers or private areas, like a yeast infection, but I'm not sure why. Then I asked, are you thirsty a lot? Getting up at night to pee? She looked surprised. You're spot on, doctor. I've been exhausted lately, too. Linda's symptoms, inflamed gums, recurring skin, and urinary infections might sound small, but they're actually major red flags for diabetes. Here's what many don't realize. When blood sugar is high, your immune system gets weaker. Your white blood cells, the police force of your body, don't function as well. This means bacteria, fungi, and viruses can invade more easily. Vulnerable areas like the mouth skin folds or urinary tract become entry points for infection. Many people over 60 think itchy skin gum problems or recurring UTIs are just age-related. But did you know up to 40% of people diagnosed with diabetes first noticed the condition through minor infections? Linda's case was one of them. Her fasting blood sugar confirmed full type 2 diabetes. Thanks to early detection, she adjusted her diet, started light exercise, and followed her doctor's advice. And the result, within 3 months, those infections almost completely disappeared. My friend, a big disease often begins with small signs. Never ignore recurring issues like gum bleeding, skin itchiness, or repeated UTIs. Watch for signs like bleeding gums despite brushing carefully, itchy skin or fungal infections between fingers, toes, or in sensitive areas, mild UTIs, burning odor frequency, unexplained red bumps or sores on the skin. Remember, health is the greatest gift. And the best part is, you still have time to protect it. Start by paying attention even to the smallest signs. Dear friend, if you've stayed with me this far, it tells me something beautiful. You truly care about your health, and that to me is the first step toward a stronger, more vibrant life. We can't turn back time, but we can get to know our bodies better so that every day from now on is one of greater meaning and better health. Diabetes isn't the end of the road. It's a gentle reminder that it's time to slow down, to choose more intentionally, to love yourself more deeply. I'm Dr. William, and after nearly 40 years working with older adults, I've learned one vital truth. When you learn to listen to your body, you can change your entire life. So today I have a small request for you. Share this video with someone you love, maybe an old friend, a neighbor, or someone from your senior group. Subscribe to this channel so you and I never miss a single helpful story in this health journey. And in the comments below, let me know, which of these early signs have you ever experienced? What would you like me to explore more in the next video? Because health doesn't come from grand gestures. It comes from small, consistent choices made every day. Thank you for being here. And remember, your body is not your enemy. It's your oldest companion, and it's always speaking to you with kindness.